University of Washington, and she's going to tell us a little bit about a study they did on air pollution and sleep patterns.
And I'm presenting this study looking at the relationship between air pollution and sleep disruption, utilizing the multi-ethnic study of atherosclerosis. So what we looked at was, we know that air pollution is associated with a lot of bad health outcomes, such as premature death, cardiovascular mortality, as well as chronic lung disease issues, worsening asthma exacerbation and COPD, but there's not cross there as so lots of geographic variation, gender balance, and also racial and ethnically balanced study, or what kind of pollution they would be exposed to, and we modeled out over time what their exposure was, having a poor sleep efficiency. So we found about a 60% higher rate of a low sleep efficiency among those people in the highest, highest chronic exposure levels to air pollution compared to those with the lowest. We also found it was associated with prolonged wakefulness after sleep onset, and that was also true among people exposed to higher levels of particulate matter 2.5, or PM, associated with poor sleep and sleep disruption. We did not find an association with sleep apnea as measured by the apnea-hypopnea index in this study, however. So the kind of take-home points are that if you are exposed to high pollution over years, it may have an impact on your sleep quality and lead to more sleep disruption. What we don't know is if it was the pollution itself or markers associated with pollution, such as noise and other factors that are associated with higher levels.
You had 6 different sites.
Right.
Did the relationship hold across each site, or was it driven by, for example, the difference between LA and you know, where pollution might be associated with?
Yeah, they're definitely New York. And so it was kind of difficult to tease out site-specific effects, because if you controlled for that, there's a lot of variation that you kind of lost, because there was differences in racial and ethnic groups that were recruited from each site, as well as socioeconomic. So
Causing something which disrupts sleep, or is it that the pollution is a marker such as proximity to noise or some other effect which itself is the main driver of the disruption of sleep?
That the patients were experiencing? Were you monitoring it during the day or just while they were sleeping? How did that work?
yeah, so this was a study looking at, the parent study was looking at cardiovascular outcomes, so it was continuously monitored. So they sampled pretty much at chronic exposure of 5 years and also 1 year. But the sleep was just measured in one time of a 1-week actigraphy. So yeah, clearly it wasn't, we don't know how they were sleeping 5 years before that. But it's
Pujoli, who's going to tell us a little bit about the relationship between sleep apnea and pregnancy and associated problems.
I'm at Brown University, and the study that we're talking about tomorrow is a study that was done on a national cohort. It's called the National Perinatal Information Center. So the reason why we're interested in pregnancy is because there are some profound cardiovascular and pulmonary changes that happen during pregnancy, and many of those can affect sleep disordered breathing in pregnancy, and it may predispose to it. And the reason why we're interested in that, even though pregnancy only lasts for 9 months, is the fact that these sleep disordered breathing in pregnancy has been linked to some bad outcomes in pregnancy, like preeclampsia and gestational diabetes. Recently, there was a prospective study that had about 3,000 pregnant women or so that showed that pregnant women that had sleep disordered breathing were more likely to have an elevated risk of gestational diabetes and preeclampsia, whether sleep disordered breathing was happening early in pregnancy or later. But what the prospective studies can't really look at are these rare outcomes, because they don't happen too often, so you need these large numbers of patients. So our sample was from 2010 to 2014. We had data from 95 hospitals. Most of them were from the South. The majority were teaching hospitals and had over 5,000 deliveries, so about more than 40% eclampsia with gestational diabetes, eclampsia, stillbirth. The prevalence was elevated with those, but it was also associated with cardiomyopathy, congestive heart failure, an ICU admission, so the risk for an ICU admission was significantly elevated. And the length of stay in the hospital was about 2 days on average long. Complicated things that happen in a young, theoretically healthy population, but I guess the population that and it pushes us to study it a little bit more and to try to understand what we can do to try to prevent these outcomes and possibly impact mom's health long-term and baby's health long-term as well.
I think I heard you say, the risk, obviously, of, if you have sleep apnea, the risk of all these negative maternal outcomes is high. But then when you adjust for some of the things which we know are themselves causes of some of these risks, such as obesity, hypertension, and so on, was there a residual independent effect of
Yes.
OSA? There was?
Yes.
Okay, then, but at the end you said something about it going away, so I...
Oh, just for the growth restriction, as soon as we had 3 models, but I'm only presenting 2 of them. So we had one model with obesity, one model with pre-gestational hypertension and diabetes. As soon as we introduced the pre-gestational hypertension and the diabetes, that association went away.
Which association?
With a stillbirth and the birth.
Because the risk goes away when you remove, or you adjust for a confound like hypertension, doesn't mean that there isn't a causal path.
Apnea, was it almost entirely obesity? Was it other health factors?
No, actually, it wasn't entirely obesity. One of the
Let me try to find out, since sleep apnea actually varies in terms of severity and diagnosis from persons to persons, are you concluding that everybody who is suffering from sleep apnea, no matter the severity, may come up with these problems, or you actually try to exclude the severity factor and associate it with what was expected?
So with this study, we weren't able, because we didn't have the actual sleep studies, we weren't able to differentiate with the severity of the different sleep apnea in patients. But it is possible that the study is a little bit biased because more severe people are more likely to have a diagnosis code of obstructive sleep.
And the plus side of big data is it kind of washes over a lot of the confounds of small groups, but the down...
create?
So how it impacts pregnancy outcomes. There have been some small...
presentations. Who's speaking from the Jackson study, speaking from Harvard.
Yeah, so my colleagues and I did a study to investigate the prevalence of undiagnosed sleep disorders in a population of African Americans. So in general, we know that sleep disorders are highly prevalent. So it's estimated that between 10 and 30% of U.S. adults have sleep apnea, and then around 30% of adults report at least one insomnia symptom or more. And so although there's this high prevalence, there's also racial and ethnic disparities in these sleep disorders. So for example, African Americans tend to have an earlier age onset, which translates to a longer cumulative exposure to the sleep disorder. And so data from the multi-ethnic study of atherosclerosis, a separate study which Dr. Billings described, they found in their study that only 15% of African Americans with measured sleep apnea reported a doctor diagnosis. So that's around 85% that have undiagnosed sleep apnea in this population. And so this is one study. So we were interested in replicating the study and look at, in a larger population of African Americans, are they going to have the same rate? So what's the prevalence of undiagnosed sleep disorders in this particular population? And so in addition to looking at the prevalence, we also wanted African Americans. So to answer our research questions, we used data from the Jackson Heart Study. And so the parent study is a longitudinal or had sleep apnea. So this is an apnea-hypopnea index over 5. And then about 37% had one higher than 15, which is moderate to severe sleep apnea. And so we also found that only 4% of that 37% reported a doctor diagnosis, and only 7% reported a physician diagnosis, and this translated to about 93% had undiagnosed insomnia. Which may relate to insomnia, which included female sex. So for sleep apnea, I said male diagnosed sleep disorders, so again 96% for undiagnosed sleep apnea and 93% for undiagnosed insomnia. And we found that there was the traditional risk factor, so the same as diagnosed sleep apnea that related to undiagnosed. So there was no differences. So the take-home point from this is there's clearly a need for interventions to increase awareness of sleep disorders and also to bring attention to more screening for sleep disorders in African American populations. So although we found a higher rate of undiagnosed sleep disorders, it's still a high rate in African Americans in addition to what was found in Mesa. And so also if we're able to screen these, we may be able to treat them, which could increase the quality of life for people with undiagnosed sleep disorders, which could also potentially decrease the burden of subsequent poor health outcomes.